Chair DeGette, Ranking Member Guthrie, and members of the subcommittee. Thank you for this invitation to appear before you on behalf of the Department of Health and Human Services. I welcome the opportunity to discuss the Title X rule and the Title X Family Planning Program. I'm the Deputy Assistant Secretary for Population Affairs under the Office of the Assistant Secretary for Health. Over the past year, it has been my privilege to work with professional career staff, grantees, and health professionals who make it their mission to ensure that Title X funds are used to provide quality family planning services to the adolescents, women, and men who need them. My professional career has been spent practicing pediatrics with a focus on adolescent health. While chief resident in pediatrics, I was a Title X provider in one of the first school-based health clinics in Indiana. After residency, I founded and served as medical director of a pediatric practice and spent the next 17 years establishing one of the largest private pediatric practices in central Indiana. In 2004, I relocated to Colorado, and my practice was limited at that time to adolescent gynecology. At the same time, I provided direction to a nonprofit organization and implemented a federally funded sex education program in the Colorado Springs area. Part of that direction included developing a program to teach adolescents about sexually transmitted infections and contraception. Most recently, I practiced pediatrics in a rural critical access hospital in southeastern Colorado. Title X of the Public Health Service Act was enacted in 1970 and authorized the establishment and operation of voluntary family planning projects, offering a broad range of acceptable and effective family planning methods and services, including natural family planning methods, infertility services, and services for adolescents. The Title X program serves close to 4 million clients every year in over 3,900 clinic sites. Currently, there are 90 grantees using Title X funds, including state health departments, family planning councils, federally qualified health clinics, and private nonprofit entities. These grantees are located in all 50 states, the District of Columbia, Puerto Rico, U.S. Virgin Islands, and the 6 Pacific jurisdictions. I'm proud to direct the efforts of dedicated career staff who are committed to promoting health across the reproductive lifespan. The 2019 Title X rule ensures program integrity and compliance with statutory provisions, and in particular, the statutory prohibition on funding programs where abortion is a method of family planning. This rule will promote quality family planning services to clients while ensuring that taxpayer dollars are spent according to the original intent of Congress. This rule provides for clear financial and physical separation between Title X and non-Title X activities. This will assist grantees and prevent reporting deficiencies. It will make it clear to clients and the general public that Title X funds are being used according to the law. This rule protects the provider-client relationship. It is not a gag rule. Health professionals are free to provide non-directive pregnancy counseling, including counseling on abortion. This rule protects the conscious rights of health professionals, including Title X providers, grantees, and applicants, by eliminating the requirement to counsel about and refer for abortion. This rule ensures consistency with and eliminates any confusion about the department's longstanding policy to respect these rights. The rule does not prohibit health professionals from providing medically necessary information to clients. In fact, by requiring referral for those conditions where treatment is medically necessary, this rule ensures quality health care for women. In line with statutory requirements, referral for abortion as a method of family planning is prohibited. However, referral for abortion is permitted in cases where there are emergency medical situations. This rule will protect women and children by ensuring that every Title X clinic has a plan to report abuse, rape, incest, as well as intimate partner violence and sex trafficking. This is in accordance with the individual state laws. It requires that all Title X clinics provide annual training for staff, not only to recognize those clients who have been or are being abused, but also to provide appropriate follow-up for them. This rule provides guidance to grantees to encourage family participation in the decision of minors seeking family planning services. It will advance meaningful family communication, providing important support to adolescents as they make these decisions. By expanding criteria for grant applications, this rule will increase competition and encourage innovative approaches to unserved populations. First and foremost, the revisions to the Title X rule promote the well-being of individuals, families, and communities across the nation. Thank you once again for having me here today. I look forward to discussing how this rule will ensure the Title X program remains in compliance, but also fulfills the original purpose of Congress so that more adolescents, women, and men are able to achieve their family planning goals.